morning, I'm Karina Benitez.
And I'm Rami Urgis.
And today we have a very special segment. We're going to be discussing Chagas disease.
Yes, Karina, that's right. This disease is mostly localized in Central and South America. But today, we are seeing more and more cases emerging in the United States.
And that is why we want to learn more about this disease and its long-term effects.
Now, we know that Chagas disease affects several organs of the body, including the gastrointestinal tract. However, we are going to focus on its devastating effects on the heart.
Currently, an option to treat Chagas cardiomyopathy is to undergo heart transplantation. However, there was a study recently conducted on a new possible treatment that may shed light to patients suffering from Chagas-induced cardiac failure.
We have a couple guests today that will be explaining to us exactly what Chagas disease is, how it progresses enough to develop cardiomyopathy, and what the new treatment is all about.
And to explain Chagas, we have Dr. Nieves with our reporter, Dixie Duran.
Thank you, Karina. We're here with Dr. Nieves today. Good morning, Dr. Nieves.
Good morning, Dixie.
How are you today?
I'm very good, and you?
I am awesome. So talk to us a little bit more about Chagas disease.
Well, Chagas disease is caused by a parasite called Trypanosoma cruzi. This parasite is also classified as a protozoan. It is transmitted by blood-sucking insects. This is why it's called the kissing bug. Yeah, it can also be transmitted from a vertical form. This is by mother-fetus transmission.
Okay, and can you tell us a little bit more about how our body reacts to this parasite?
Of course, I can talk about the immune response against this parasite. Well, in the body we have two areas, which are the innate immune response and the adaptive immune response. In the innate response, we have the antigen-presenting cells. In this case, the responsibles are the macrophages and the dendritic cells. We also have other cells that is not an antigen-presenting cell, that is called the natural killer cells. We also have the adaptive, as I said before, and in the adaptive immune response, we have mostly the CD8 T cells.
Interesting. I heard that Chagas disease has an acute phase and a chronic phase. Can you explain the difference between those two?
Yeah, it does have an acute phase and also a chronic phase. The acute phase presents with parasite in the heart bloodstream and in tissues like the heart. The problem with this acute phase is that it's mostly asymptomatic. This means that the patient do not present with symptoms, so it cannot be diagnosed at any time. The patients that do develop symptoms, which are the lesser in the population, present with fever, inflammation in the inoculation area, unilateral pulmonary edema, lymphadenopathy, and hepatomegaly.
And what about the chronic?
Yeah, the chronic phase leads to cardiomyopathy, which is a muscular heart disease. The chronic stage usually presents 10 to 30 years after the initial infection, disease after the acute response. It is characterized by sparse inflammatory infiltrates as well as minimal parasites in the bloodstream of the host.
Can you tell me what cardiomyopathy means and how is it that the parasite eventually leads to cardiomyopathy?
Yeah, well, as I mentioned it earlier, cardiomyopathy is a muscular heart disease. And how does this happen? Well, it is not known for sure. I mean, there are not been so much researches in this area, but what they believe by this time is that it is a four mechanism. The mechanisms are the neurogenic disturbances as well as the microvascular disarrangements and the parasite-dependent damage. And in the end, we also have the immune-mediated injury. What is important here is that it's believed that just the last two that I mentioned, which are the parasite-dependent damage and the immune-mediated injury, are the main contributors to the disease.
All right, Dr. Nieves. Since you said that the last two were the main contributors, let's go ahead and focus on these. What exactly is parasite-dependent damage?
Yeah, the parasite-dependent damage is the persistence of the parasite in the human house for a long period of time. This leads to reparative and reactive fibrosis.
So would you say that the fibrosis is what damages the heart?
Yeah, that's right. Which means that instead of the fibrosis, which is supposed to be the last phase of the immune response to recover the area that was inflamed, instead of help, what it does is provoke a worsening of the patient, which is supposed to not happen.
All right. What about immune-mediated injury?
Yeah, the immune-mediated injury is caused by the monocyte and the damaging cytokines, which are the inflammatory mediators in the immune response. Some of the inflammatory mediators that have been proved in situ to cause this damage in the trichomonosomal cruzi infection, which is Chagas disease, is the nitric oxide, TNF-alpha, and interleukin 6, which help to control the paracyte load.
Okay. This next question seems like I asked you this before, but just to wrap it all up, can you explain to me how the cardiomyopathy comes about?
Yeah, it is thought that the excessive and the persistent inflammatory are the ones responsible to cause the heart damage. It is also thought that there is an imbalance between the CD8 T cells and the regulatory T cells.
And what exactly are T regulatory cells?
Well, the regulatory T cells are the one in charge to control the immune response.
Okay. And so you're trying to say that they also think that there's too much cytotoxicity from T cells, but not enough regulation from T regulators.
Yeah, and that imbalance is one of the contributors to the disease of the heart.
Wow, doctor, that's a lot of information. I think that's about it, unless you have anything else to add.
Yeah, I would love to thank you for the invitation. I really look forward to be here again.
Okay, well, thank you for being here, and thank you for sharing all of your knowledge. We'll take it back to Karina in the studio.
Thank you so much, Dr. Nieves, for that very helpful information. We also have Dr. Rapoz here with us today, who's going to tell us a little bit of information regarding a new treatment that may be an option for future patients.
Thank you, Ronnie. So good morning, doctor. Thanks for being with us today. So tell us a little bit more about the treatments that these patients have for Chagas disease.
Well, thank you for inviting me, Karina. It's my pleasure to be here today. So, treatment for Chagas disease is a little limited. We've had for 40 years the same antiparasitic drugs that only treat the acute phase of the disease, doesn't treat the chronic phase where this cardiomyopathy begins or affects the patient. So one of the options we have for when it's chronic is heart transplantation. But heart transplantation, at first, we thought it wasn't possible. We thought it was contraindicated because when you transplant an organ, you have to immunosuppress the patient, so that could lead to the infection coming back because your immune system is not working. But in 1985, in Brazil, the first heart transplantation for Chagas disease was done, and since then, that was the treatment used when the patient's in this stage. So the patient has to go through evaluations, and there's a list to get a heart. So it's not a really good treatment, not accessible for everybody. You can die waiting for a heart.
So what other options do these patients have?
Well, actually, last year there was an article published to possibly treat this chronic phase of the disease, and it emphasizes on treating the inflammation and promoting the angiogenesis. So they synthesize a new ligand, which, bear with me, attaches to peroxisome proliferator activated receptor gamma.
So I'm just lost.
So this activator emphasizes in lipid metabolism, insulin sensitivity, and inflammatory response. That's what we want.
Okay, so you're telling me this is an anti-inflammatory treatment then?
Yes, it is.
Okay. So how would this benefit the patients that develop cardiomyopathy?
So in the experiment, the results they measured nitric oxide and tumor necrosis factor, which are inflammatory mediators, and they saw a decrease in that, which is good. And also they saw that the ligand promoted tissue repairs with some pro-androgenic markers. And most important, they also saw that this ligand can suppress a pro-fibrotic marker. So they actually saw less areas of fibrosis on the tissue of the mice.
Oh wow. So what is the negative side of this treatment?
So the treatment doesn't affect the course of the infection, meaning that it doesn't kill the parasite. So you're gonna have the same levels of parasite, the same weight. It's not gonna be killed. It's still gonna be present.
So you're just like actually treating the disease, not killing the parasite.
No, exactly. So we still have to do more research about this. This could be really helpful for persons that are like in an ending stage that can delay it, but still we have to do more.
So how would this be a better option than heart transplantation?
So the new treatment will be less risky, less invasive, and more accessible to patients than a heart transplantation. But we have to take in consideration they're still in animal trials, and if they do reach human trials, it will be a coadjuvant of the antiparasitic treatment to delay the onset of heart damage.
All right, and thank you for sharing this valuable information with us.
Thank you for having me.
And we'll see you next time. So, Rami, what do you think about all this information that has been shared with us today?
Well, Karina, as far as treatment goes, I think that we're definitely moving in the right direction. If you think about it, any option other than having to undergo open heart surgery and being on immunosuppressants for the rest of your life is a giant leap. That's for many reasons. We could possibly have a rejection of the heart transplant. It could be forever waiting on the waiting list until we receive a heart. So these are just some of the problems that we could come across. Delaying and maybe even reducing the effects of cardiomyopathy sounds like we're definitely moving a step closer to finding a solution to this devastating disease.
Yes, it definitely sounds great. So, but there's still not a cure for this disease, for eliminating all of the source. So I think it is shocking how we're still using the same treatment for the past 40 years, and there is still not much advancement of this in terms of treating it. So there is still a lot of research to be done before we find a cure or even an effective treatment for Chagas disease. Also, keep in mind that we only focus on the cardiac affections today and not on all of the systems. So this is only the tip of the iceberg.
Definitely, yes, I do agree with you. But if you think about it, it is better than not treating it at all. Speaking of not treating it at all, we have a bigger issue in places such as Central and South America, where Chagas is an endemic, where they do not even have access to treatment, and that is a huge problem, one that we need to find a cure to.
Well, as Dr. Nieves mentioned, the mechanisms of pathogenesis are still not very well defined. So definitely we need to start upping up our research game before we can even find a cure. All right, guys, I think this is all we have for you today, and see you next time for more medical news here in Nothing Med.